Hello everyone, my name is Dr. Haematogenous and you're watching sqadia.com. And today our lecture topic is infections. And in this section, we'll be going through the general aspects of the infection. We'll be going through how the spread of microbes occurs in our body, what are the classical features of the infection, and what is the difference between acute infection and chronic infection. So what are infections? Condition in which the pathogenic microorganisms multiply and spread within the body tissues and usually give rise to an acute or a chronic inflammatory reaction. What actually happens is whenever a foreign material, a foreign microorganism enters in our body mounts a response to it. Now, if this response is contained, usually infections will not occur. But if there is any reasons, and I will be discussing those reasons, what are the host factors in subsequent slides, that if for any reasons a host cannot mount a response against those microorganisms, this results in the multiplication of microorganisms in our body, leading to infection. So, coming to the general aspects, depending on the type of invader, the site of infection, and the host response, the result could be a pyogenic osteomyelitis, septic arthritis, a chronic granulomatous reaction. Now, the reason these three examples are given is, for example, a host is immunocompromised for any reason. And if there's an acute attack of microorganisms, this would result in an acute type of infection, which could be as simple as pyogenic osteomyelitis. Or if it is involving the joint, it would result in acute septic arthritis. But for example, it was not as some kind of an organism which had an acute attack. For example, a host was infected with tuberculosis. Now, tuberculosis has a very indulating chronic type of way, and in which usually a chronic granulomatous reaction occurs. And patients, instead of getting an acute kind of an infection, they usually get a chronic granulomatous infection of tuberculosis. How do the spread of microorganisms occurs? Microorganisms may reach the musculoskeletal tissues by introduction through the skin. For example, that could be a pinprick and could be a faulty injection, could be a stab wound, laceration, an open fracture, and an operation. Even iatrogenic causes include surgery, because sometimes the infection is actually transmitted through surgery, particularly when biomaterials or implants are involved. For example, when we are doing the surgery of suppose total knee replacement or total hip replacement, when the metal work is put into the place in the joint, those joints are actually highly vulnerable to infections. So special care has to be taken so that these prosthetic joints do not get infected. This could be simply direct spread from contagious focus on infection. It could be indirect spread via bloodstream from a distant site such as nose or mouth, the respiratory tract, a bowel or GI tract. The patient could not have any of the problem. The patient did not suffer from any trauma. There was no pinprick, no laceration, but child probably had a sore throat. And sore throat, there would be definitely some organism that would be multiplying. They can spread to the joint via bloodstream and do the damage they want. They are made to do. Now, coming to the classical signs of infection, these include redness. Whenever there would be infection of a joint or in the area where this infection would be involved, this would usually involve hyperemia. There will be erythema or redness or flare of the soft tissue. There will be swelling. Why would there be swelling? Because there definitely, when microorganisms will go there, then body will mount a response. There will be neutrophilic infiltration, there will be lymphocytic infiltration, then there will be giant cell infiltration. This would result, there will be a lot of hypervascular area, leading to a lot of exudates being formed, and this exudates, when accumulates in the soft tissue, results in swelling. Now, heat, because as the space becomes hypermetabolic and there is a lot of activity going on so that they limit the response, so that limit the spread of microorganisms. This usually makes that area, as it is hypervascular, therefore it becomes hot, or the heat is usually a sign of inflammation. And then above all, pain. Why? Because these microorganisms, when they are being contained, there are a lot of mediators being released. These especially includes interleukins, tissue necrosis factors, and all these. Now, the interleukins are sometimes involved in exciting the neurons, so that whenever there is an infection, there is redness, there is swelling, there is heat, and there is pain over there as well, due to stimulation of the neurons from these intermediate interleukins. And if it's involving the joint, just imagine a joint is swollen, it's red, it's hot, and it's painful. Then definitely that joint will have a loss of function as well. That joint cannot function as a normal joint. Normal range of movement of that joint just cannot take place. And if it's osteomyelitis, which usually involves bone, only the other signs such as redness, swelling, heat, pain are present. But if it's joint, then it's along with that there is a loss of motion, a range of motion is lost at the joint as well. These are all the classical signs of infection. Now, if you consider this as a diagram of a bone, the point here you want to make sure clear is that bone is not basically an open space, it's a joint space. And if you see it over here, that it is actually a very closed and a closed tight compartment. It's not that things can spread from here and there and go all the way. It's surrounded from outside from the thick layer which is called as periosteum. Now, periosteum is adherent to the bone, so that it does not allow actually passage of microorganisms directly attacking the bone until unless this periosteum is breached. Now, there would be a nutrient artery would be coming in the diaphysis, it would be ascending and descending as well to supply mainly the diaphyseal part of the bone. There will also be in the epiphysis, there would be arteries would be coming in. And in children, usually there is actually an anastomosis between the metaphyseal and epiphyseal arteries. Now, the important point is, if you see it over here, this is another 3D view. The nutrient artery is coming in, it's dividing into branches, and it's giving into branches into the different areas of the bone. It's going on. But if there's an infection over here, it cannot come out like this unless this periosteum is breached. So this is where the real problem is. If infection starts over here, it has come from blood and it has resided, microorganisms resided in the metaphysis, and they start to multiply. Once they start to multiply and there is no check, or they have not been checked properly, then what results is that there is exudate formation over here, and unless they cannot go across the periosteum unless they breach the periosteum. So what results is this actually starts the necrosis of the bone. And this why? Because now all the blood which is actually coming is being all the factors which were supposed to come and provide nutrition to these bone cells will not have the adequate oxygen and nutrition, so they will start dying, and this results in necrosis. That is why this is basically a very disastrous thing, that once the osteomyelitis starts, this can actually literally eat a bone from inside out, despite the periosteum being very much normal and intact. So this is a diagram which is showing actually difference between osteomyelitis and arthritis. Word arthritis means joint involving the joint. Itis is inflammation of the joint. When it involves joints, it's arthritis. If it is involving the bone, usually it is most commonly the metaphyseal part of the bone. If you see over here, this is the epiphysis, this is the epiphyseal plate, this part is the metaphysis, and this is the diaphysis. If it all starts in the metaphysis and spreads outward, this is called as osteomyelitis. And now over here you can appreciate is that actually the periosteum is lifted off as the pus has actually accumulated. As I just told you before, as it is a closed space, so periosteum does not allow a lot of organisms to spread outside the bone. So as a result, the necrosis of the bone would start on this side, and this would literally eat up the bone from inside. But if it involves the joints, as you can see over here, as usually uric acid crystals involve, they call inflammation of this joint as well. This could be simply other microorganisms, not necessarily related to uric acid, but when the joint is involved, that is called as arthritis, and when the bone is involved, that is called as osteomyelitis. Osteomyelitis is the infection of the bone, and frequently it seeds in the trabecular areas affecting both bone and both bone marrow. When infection spreads to the nearby joint or only the joint is involved, it is called as arthritis. Now, as I told you, not every one of us gets infection. There are certain factors we are actually exposed to organisms all the time. As I'm breathing in and out, definitely a lot of microorganisms are going through. I'm inhaling a lot of microorganisms, but I don't want to be getting infected straight away unless there are certain factors which make a host prone to certain infections. And these include these predisposing factors which make a host prone to infection include malnutrition and general debility, diabetes mellitus, corticosteroid administration, immune deficiency, immunosuppressive drugs. For example, somebody is on chemotherapy, venous stasis in the limb, peripheral vascular disease, loss of sensibility, iatrogenic invasive measures, trauma, and all this. Now, there's why these are also venous stasis and peripheral vascular diseases, because they usually are in kind of conditions where the peripheral senses are actually lost, and one is not really sure when somebody got some kind of a pinprick or toe got infected, and then once the infection spreads proximally, then he or she realizes that the infection has actually spread from the great toe. Coming to the microbial factors, then there are definitely certain viral strains of the organisms are more virulent than the other. So actually the factors which include microbial factors, they are bacterial colonization and virulence of organisms involved, resistance to antibiotics, and formation of biofilm. For example, Staph aureus, this organism is highly notorious because it has the ability to make biofilms, which makes it resistant to antibiotics and even the cell's immune response. As a result, host cannot mount an immune response to these organisms. Now, coming to what is the difference between acute and chronic. As the term word suggests, acute is sudden and severe in onset. So it is sudden and severe in onset of infection. This results in usually formation of pus or abscess. There's a lot of exudate formation, systemic reaction of lassitude and pyrexia. If children who are infected with acute infection, they usually show lassitude and pyrexia. Severe reaction may cause septicemia, may spread further via blood and lymph. On the other hand, if you see the chronic infection, they are slow and long lasting. They have very long progressing course. Cellular reaction may produce granulomas. For example, in case of tuberculosis, associated with lymphadenopathy and splenomegaly, there is generalized wasting and weight loss, may spread further via blood and lymph. They both can spread actually via haematogenous or lymphogenous spread. Thank you for watching sqadia.com.